Hi, today I want to explain egg donation treatment. The only way for patients who cannot achieve pregnancy using their own egg to have a babies through egg donation treatment. After our patients reach out to us, the treatment protocol is determined and a suitable egg donor is found for the couple who wants to have a baby. Our IVF coordinator tells us in detail when the patient will arrive in Cyprus and what medications should be used. Today, our patients come to North Cyprus for treatment of IVF from almost all over the world, from Singapore to United States of America. And the number of couples arriving is increasing every day. So, what exactly is an egg donation treatment? As you can see in the image next to me, eggs are collected from a healthy young woman aged 20 to 26 years who will donate eggs through the oocyte pickup process as in the in vitro fertilization method. On the day of collection, fertilization is performed with the sperm of the father-to-be in a laboratory environment using the intracytoplasmic sperm injection method. Sperm donation is a simple process. If the mother-to-be and father-to-be cannot come to Cyprus on the same day, the father-to-be can come earlier and return to his country after his sperm donation. Sperm will be frozen and can be used by thawing on the day of egg collection. In the previous image, we talked about combining egg and sperm. We can do this in two ways. The first is classical IVF, that is waiting for the sperm enter the egg on its own. The second is microinjection, that is the intracytoplasmic sperm injection procedure. We generally prefer the ICSI procedure due to its higher success rate. The egg collection or oocyte pickup, as we abbreviated it, it performed just like in a normal IVF procedure under anesthesia in the IVF operating room with the guidance of vaginal ultrasound probe. The ovaries are entered with a fine needle and the eggs are collected together with the fluid they are in and delivered to the embryology specialist. After a waiting period of approximately 3 to 4 hours, the ICSI procedure is applied. 24 hours after the ICSI procedure, we can see how many of eggs have been fertilized. 24 hours after fertilization, the embryos move to 4-cell stage, and on the third day, they move to 8-cell stage. On the fourth day, the cells reach the stage that we call compaction, and fifth day, they reach a very complicated structure, which is the stage that we call a blastocyst. The embryo transfer stage is perhaps the easiest but most important step. It is the injection of the embryo into mother's womb with a thin cannula under ultrasound guidance. The number of embryos to be placed in the uterus is decided according to the conditions of the mother-to-be and the condition of embryos on the day of transfer. Approximately 12 days after the transfer, we can understand whether the treatment was successful by performing a urine or blood pregnancy test. Our patients usually share this happy news with us as soon as they learn it, and this is our source of motivation. Approximately 1 week after the pregnancy test have been positive, the gestational sac becomes visible on ultrasound. Approximately 2 weeks after the gestational sac becomes visible, we can observe or detect the first heartbeat with an ultrasound. It is our greatest pride to see the happiness of couples we have never known until they start treatment. To summarize the treatment, first, we started treatment with the stimulation of donor's ovaries. The second stage is egg collection and sperm sampling. Fertilization of eggs is performed on the same day. In the next stage, the embryos are delivered in the laboratory environment until the day they are transferred. The last stage of the treatment is embryo transfer, and 12 days later, we do a pregnancy test to find out if the procedure was successful. Thank you for your attention.